This is Elle Howe, NATF's Education and Outreach Coordinator, and we're here to discuss the recent report that women's tennis player Serena Williams has been recently diagnosed with a pulmonary embolism. We're joined by Dr. Gregory Piazza from the Brigham and Women's Hospital VTE Research Group and board member of NATF. Hi, Greg.
Hi, Elle. Thanks for having me.
Well, thank you for coming. So why don't you start with telling us what a pulmonary embolism is?
Sure. Pulmonary embolism is when a clot that usually forms in the lower extremity veins or pelvic veins travels through the right side of the heart and then lodges in the pulmonary arteries.
What are the consequences of a PE?
Pulmonary embolism can lead to strain on the right side of the heart, increased pressures in the pulmonary arteries, which can present as shortness of breath or exercise intolerance. Particularly severe pulmonary embolism can cause failure of the right side of the heart and can even be fatal.
Wow. So I was surprised that someone as physically fit as Serena Williams suffered a PE. So how is this possible?
I was very surprised to hear that too, although we do get reports every once in a while of professional athletes suffering pulmonary embolism. I think in her case, she had a series of recent orthopedic injuries requiring surgery, and we know that both trauma to the lower extremity and surgery predispose to pulmonary embolism and deep vein thrombosis. As is common for many female professional athletes, she was probably on an oral contraceptive pill or other hormonal contraceptive technique, which further increases her risk, and we don't know if she has a genetic predisposition to forming clots.
I see. So what are some of the symptoms she would have faced having a pulmonary embolism?
Common PE symptoms include chest pain, shortness of breath, exercise intolerance. Major pulmonary emboli can sometimes cause dizziness or even fainting. And then patients will often complain of symptoms of deep vein thrombosis, such as lower extremity swelling or pain.
I see. So how is PE treated?
For most patients, I'm sure including Serena Williams, immediate blood thinning with either an intravenous or subcutaneous injectable form of anticoagulant is important early on, and then patients are given oral anticoagulation with an agent such as warfarin.
Oh, great. So how can physically active people prevent PE?
Well, it's important that the patients stay physically active. It's important to lead a heart-healthy lifestyle, emphasizing a diet that's low in fat, low in cholesterol. Regular cardiovascular aerobic exercise is important. Smoking cessation is very important because that's a risk factor for developing DVT and pulmonary embolism. And then avoiding any behaviors that might further increase risk. In Serena Williams' case, she couldn't really avoid having the orthopedic injuries or surgery, but it's important around the time of surgery to make sure that some measures are taken to prevent DVT, such as the use of compression stockings or medications to prevent clots.
Great. Well, Greg, thanks for coming and answering our questions.
No problem. Thanks so much for having me.